Right now, millions of older adults are taking medications that could be silently destroying their hearts. And here is the shocking part: these are not illegal substances or experimental treatments. These are common drugs sitting in medicine cabinets across the world, drugs that doctors prescribe every single day. A growing number of cardiac surgeons and cardiologists are now sounding the alarm. They are seeing patterns in their operating rooms that they cannot ignore. Hearts that should be relatively healthy for a patient's age are showing damage that seems almost impossible. Inflammation markers are through the roof, heart muscle is weakened, rhythm problems are appearing out of nowhere, and when they trace back the medical histories, they keep finding the same culprits over and over again. The research is finally catching up to what these surgeons have been witnessing firsthand. Major studies from institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology are now confirming what many suspected. Certain medications that millions of older adults take regularly are causing measurable documented heart damage. We are not talking about rare side effects that happen to 1 in a million people. We are talking about significant cardiovascular risks that affect substantial percentages of users. Some of these drugs increase heart attack risk by over 40%. Others double or even triple the chances of developing dangerous heart rhythms. And the most alarming part is that many patients have no idea they are at risk. But there is one drug on this list that stands above all the others. One medication that cardiac surgeons are now calling the silent heart killer. The research on this particular drug is so alarming that some experts believe it should carry a black box warning specifically for older adults. A massive study involving over 500,000 patients found that this drug was associated with catastrophic cardiac outcomes. And the worst part is that alternatives exist that are far safer. But before we reveal that number one drug, let me walk you through the complete list so you understand the full picture of what could be damaging your heart right now. Before we begin, let us know in the comments your age and where you're watching from. We read and reply to every single comment. Now, without any further ado, let's get started. Number 7. Proton pump inhibitors. You probably know these by brand names like Prilosec, Nexium, and Prevacid. These are among the most prescribed medications on the planet. They work by reducing stomach acid, which helps with acid reflux and ulcers. For short-term use, they are a miracle. The problem is that millions of older adults have been taking them for years, and the heart-related consequences are now impossible to ignore. A landmark study in PLOS One examined data from nearly 3 million patients and found that PPI users had a 16 to 21% increased risk of heart attack compared to non-users. The mechanism behind this damage is terrifying. PPIs appear to reduce the production of nitric oxide in the cells that line your blood vessels. Nitric oxide is critical. It keeps your blood vessels relaxed and flexible. It prevents blood clots from forming and protects against inflammation. When nitric oxide levels drop, your arteries become stiffer, blood pressure rises, the risk of dangerous clots increases dramatically. Another study from Stanford University found that PPIs were associated with a doubled risk of cardiovascular mortality. For seniors, the long-term trade-off for reflux relief might be a compromised cardiovascular system. Safer alternatives like H2 blockers or simple lifestyle changes like avoiding meals 3 hours before bed are often ignored but could save your heart. Number 6. Certain antibiotics. This one catches most people completely off guard. Antibiotics save lives, but certain classes, particularly fluoroquinolones like Cipro, Levaquin, and Avelox, have been linked to serious heart structural failures. A major study in the Journal of the American College of Cardiology analyzed data from over 7 million patients. They found that fluoroquinolone use was associated with a 66% increased risk of aortic aneurysm and dissection, a fatal bulge or tear in the body's main artery. Beyond structural tears, these drugs can cause QT prolongation, a dangerous change in the electrical activity of your heart that leads to fatal irregular rhythms. In some cases, it triggers an arrhythmia called torsades de pointes. A study in the New England Journal of Medicine found this risk was significantly elevated in patients over 65. The FDA has issued multiple warnings, stating these should only be used when no safer alternative exists. For a simple sinus infection, the cardiac risk of a fluoroquinolone is often far too high. Always ask your doctor if a safer older class of antibiotics could work instead. Number 5. NSAIDs. Ibuprofen, naproxen, and celecoxib are everywhere. Advil, Motrin, and Aleve. While they are great for reducing arthritis pain, for seniors, the consequences can be devastating. A comprehensive meta-analysis in The Lancet examined 350,000 patients and found that high-dose NSAID use increased the risk of major cardiovascular events by 1/3. Specifically, Celebrex increased heart attack risk by 37% and ibuprofen by 44%. These drugs block enzymes called cyclooxygenases, which produce prostaglandins. Some of these prostaglandins actually protect the heart. When you block them, you shift the balance toward increased clotting, higher blood pressure, and more inflammation in the arteries. NSAIDs also cause the body to retain sodium and fluid, putting a massive strain on an aging heart. A Danish study found that even short-term use, less than a week, increased cardiovascular risk. For older adults, topical NSAIDs applied directly to the joint or acetaminophen are often far safer alternatives that avoid this systemic cardiac firestorm. Number 4. Certain diabetes medications. Diabetes itself is a major risk factor for heart disease, but the choice of medication can either protect you or harm you. While newer drugs like SGLT2 inhibitors actually save hearts, older drugs called sulfonylureas, like glyburide and glimepiride, have been under heavy scrutiny. A major study in Circulation followed 250,000 diabetic patients and found that sulfonylurea use was associated with a 20% increased risk of cardiovascular death compared to metformin. These drugs force the pancreas to release more insulin, which can cause low blood sugar crashes. These crashes trigger stress hormones like adrenaline, which are incredibly hard on the heart. Some researchers believe they may also accelerate atherosclerosis, the buildup of plaque. If you are a senior on these older medications, it is a vital conversation to have with your doctor. Modern medicine now offers options that not only control sugar, but actively reduce the risk of heart failure. Number 3. Certain sleep medications. Sleep problems affect nearly half of all people over 65. The temptation to take a pill like Ambien, Sonata, or Lunesta is understandable, but these Z drugs have been linked to serious cardiovascular outcomes. A large study in BMJ Open found that hypnotic sleep aids were associated with a 4.5 times greater risk of death. Cardiovascular events were the leading cause of these excess deaths. These drugs suppress the respiratory drive, which can dangerously worsen sleep apnea, a major driver of high blood pressure and heart failure. They also increase the risk of falls and hip fractures. The physiological stress of such injuries often triggers a terminal cardiac event in seniors. Benzodiazepines carry similar concerns, often causing next-day grogginess that leads to accidents. Cognitive behavioral therapy for insomnia, CBTI, and low-dose melatonin are proven to be much safer and more effective for long-term sleep health without the cardiac price tag. Number 2. Certain antipsychotic medications. Often prescribed off-label for agitation or behavioral problems in dementia, these drugs like Risperdal, Seroquel, and Haldol are being used at alarming rates. A landmark study in the New England Journal of Medicine examined 44,000 elderly patients and found that those taking these medications had double the risk of sudden cardiac death. The deaths were primarily due to rhythm disruptions. These drugs can cause fatal QT prolongation and metabolic changes that lead to weight gain and unfavorable cholesterol. They also block alpha-adrenergic receptors, causing sudden drops in blood pressure when you stand up. This can lead to fainting and cardiac arrest. The FDA has issued black box warnings, the most serious kind, about using these in seniors with dementia. Before reaching for an antipsychotic, it is critical to investigate underlying causes of agitation, such as untreated pain or infections, which can often be resolved with safer non-pharmaceutical interventions. Number 1. Prescription opioid pain medications. This is the single greatest pharmaceutical threat to the aging heart. We are talking about oxycodone, hydrocodone, morphine, and tramadol. These drugs are effective for pain, but their impact on the cardiovascular system of older adults is undeniable. A massive study in the Journal of the American Heart Association analyzed over 575,000 seniors and found that long-term opioid use was associated with a staggering 65% increased risk of cardiovascular death. Opioids cause respiratory depression, slowing your breathing and lowering oxygen levels in the blood. This places immense oxidative stress on the heart muscle, especially during sleep. Chronic use has been shown to change the actual structure of the heart, making it resemble a heart in failure. They also disrupt the autonomic nervous system, reducing heart rate variability, a critical marker of cardiovascular health. Low variability is a known precursor to sudden cardiac death. Furthermore, these drugs suppress the immune system in ways that promote the rapid progression of arterial plaque. The cardiac surgeons sounding this alarm are not telling you to throw away your medications without a plan. They are urging a brave, informed conversation with your doctor. Many prescriptions that seemed safe a decade ago now carry documented risks that were not understood at the time. Your heart is the engine of your independence. It deserves protection. The damage from these medications is often preventable, but prevention requires awareness and a willingness to explore safer alternatives. After watching this, will you discuss your medications with your provider? Have you noticed any changes in your heart health since starting a new drug? Share your story in the comments. At Prime Years Lab, your vitality is our mission. Thank you for watching. Stay healthy and stay vital.